Yeah, did it feel a lot different than other times you've been to the dentist?
Yes, sir.
How was it different?
Because it's very much easier and you don't feel as much pain. Well, actually, there's no pain.
Dr. Sarah informed us of this new innovative laser treatment that required no anesthesia, no drilling, less invasive, no shots. It sounded too good to be true.
I like getting my fillings done with the laser. It feels weird, but it feels cool.
I said, could we do a little program? Let's take 4 dentists, and let's see how they do. 4 general dentists. And I ended up doing, I don't know, Sam might know numbers better than I do, 40 or 50 quadrants of surgery in 5 months. I was able to do it like painlessly because the postoperative pain was, to me, was unbelievably less than it was when I did it with the blade. I think at 7 months, I had paid for my laser. My ROI, which I go by, the ROI, was tremendous.
We need to get back to demanding from industry that we have true evidence for the technologies that we incorporate. Newsletters, YouTubes, some guy you know is not evidence. And our patients really deserve better. And I actually really have to take my hats off to Waterlase. They are the first laser company, this is unbelievable, but they're the first laser company that's funded a randomly controlled clinical trial, multi-center, blinded trial on using their system on vertical defects.
Is I have another tool that I can recommend without fear of losing clinical effectiveness. Ice pack usage was less with lasers, swelling was reported less with lasers, and the difference persisted through day 3 with 42% miss versus 4% laser reporting swelling, and 14% miss versus 4% laser reporting bruising.
Patient outcomes are of importance, high importance to the patient. And so what would be an example of that? No pain, no minimal post-operative pain, and no long-term pain, and a functional tooth. So no pain during treatment is key, but also post-op discomfort. That's what patients will remember, is minimal post-op discomfort. But when we're using the laser, it has water spray going, so very, very safe irrigant to use.
You know, this is impressive what's going on. It's safe to use. You have no disruption of your procedural flow. Completely safe, and I mean, it's multifunctional. You can use it for so many other procedures, which helps justify the expense of it.
So I found that the technology is amazing, and I can tell you I probably use my laser almost on every patient, everything I do, everything I touch every day. But on the hygiene side, the proof is in the results.
Yeah, because you also use Epic X, right?
Yes, we have 2 Epics here. You know, we use that because of the tissue regeneration during skin and root planing. You run a laser down the sulcus, you create very little damage, but you get reattachment.
Right.
And then it changed my practice. I use it pretty much on every patient. Just the little subtle things that you don't think about, like when you're trying to put a band on a tooth, and there's a tissue there and you can't get it out, you bring your Waterlase out, you remove that tissue, there's no bleeding, get the band on, you get your procedure done quick. When you're prepping teeth, whenever you get that tissue and you want to, now that we're scanning and you want to get a good shot of the margin, you trough that tissue, you don't even have to pack out. The customer service has been great. They've always been right there. I've never had an issue, and it's been a real enhancement in my practice, and it's actually created more interest and more joy in me in practice.
Perhaps the most underrated piece of equipment I've ever seen. It's got so many different applications. Everything from root canal disinfection to biopsies. I've done some biopsies that were amazing. as far as the healing is concerned, I've had patients come in the second day and it looks fabulous compared to the old scalpel biopsies.
And Cindy, I'd like to ask you, tell me why a hygienist would be interested in a diode laser.
Well, I will tell you, I love the laser for many reasons. As far as hygiene goes, I couldn't imagine not using a laser every day in practice. I use it every day on every patient to kill bacteria as a pre-procedural. I use it on my perio patients when we're doing periotherapy to remove all that necrotic tissue inside the pocket. I get amazing results with it. I use it for stimulation. I use it to help get rid of edema.